So a disorder associated with the larynx is called laryngitis. Laryngitis is inflammation of the larynx. Typically associated with either using your voice a lot, like yelling at a concert, singing for long periods of time, stuff like that. But it can be also associated with an infection of some sort. Typical symptoms are a hoarse throat, hoarse voice, sore throat, and if you have an infection, it's going to lead to, fever and lethargy and stuff like that. But if it extends to the epiglottis, so this is your epiglottis again, it can lead to epiglottitis. And epiglottitis is very serious because it can cover your trachea completely, and then you have no air moving in, and that's really scary. So, and because children are more prone to having problems, if their epiglottis gets inflamed, it can actually cover their entire trachea, and they could stop being able to breathe. So it's super severe in children, still severe in adults, but not as severe. In both cases, you'd end up having to go to the hospital and have that fixed so that they could breathe. The next structure is the trachea. The trachea is a very, in general, strong tube that protects, that has cartilage rings that protect the tube so that it doesn't collapse on itself. The trachea allows air to move into the bronchi. The cartilage rings are found, hold on, I'm going to go to the next slide to show you what the cartilage rings look like. So here's the cartilage rings are surrounding the trachea on all sides except for the posterior aspect. The reason it doesn't surround on the posterior aspect is because here we have the esophagus. The esophagus is a pretty much collapsed tube. But when food moves in, the esophagus can extend into the tracheal region. So that's why we don't have cartilage on the back. The function of the cartilage is to protect the airway, keep the airway open. So you can see the tracheal cartilage here. And at the very end of the trachea, we have this region called the carina. So this is where the trachea separates, and you end up having a left and a right bronchus moving outwards towards each of your lungs. So there's your left bronchus, there's your right bronchus moving into the left lung or the right lung. Associated with the trachea, we have, it's not a disorder, but a treatment specifically for breathing problems called a tracheotomy. So what a tracheotomy allows you to do is to get air to your lungs, so oxygen to your cells, even if there's a blockage or something occurring in the pharynx or the larynx. So like if you had epiglottitis, they could put a tracheotomy in, allowing you to be able to breathe still, even though that area is swelled over. I just do that every time. So they're going through the skin, and now they're going through the fat tissue. Now they're going to get through the muscle. And now we're able to actually see the trachea. So right here is your trachea, okay? That's your trachea right there. And so what they're going to do is they're going to cut through the muscle, allowing a hole to be produced where they can put the trachea tube in. This allows air to move in and out. Sorry. There we go. Tracheotomies are done by professional doctors. I thought nurses could do them, but they can't. I believe EMTs are able to do them in emergency periods, but I know that from talking to different nursing students, they are not allowed to do tracheotomies. But doctors do perform tracheotomies. Most tracheotomies, I won't say most, a lot of tracheotomies are done as an emergency to make sure that the patient is able to breathe. So the next region is the bronchial tree. So the bronchi branch off from the trachea at that region called the carina. There's a bifurcation where the bronchi come out and they go either to the left lung or to the right lung. Once they branch from the trachea, they then start to branch even further, going into each of the lobes of your lungs. And then from there, they branch even further, and they run to these tiny little structures called the alveoli. So that's why it's called a bronchial tree. So here you have the left bronchus moving, and then that branches into a, what is it called? A segmental bronchus to go to each segment of the lung. Here's a right bronchus, which branches into the segmental bronchus. And then these segmental bronchi are going to branch even further, producing tiny little bronchioles that end in these little tiny structures called alveoli. So alveoli are found in pouches. So we have these alveolar sacs that contain multiple tiny alveoli. And so these little bronchioles are going to branch there. So I typically call it primary bronchus, secondary bronchus, and then tertiary bronchus, the little tiny ones, okay? A disorder associated with the bronchi is bronchitis. Bronchitis is inflammation of the bronchial airway. And this is usually associated with either a viral infection or bacterial infection, but it can be caused by inhaling certain chemicals or irritants. There's two forms of bronchitis. Acute bronchitis, this is the one that's typically associated with either bacterial or viral disorders. And then chronic bronchitis, which is often associated with exposure, long-term exposure to certain irritants. Acute is going to occur during an infection and often is treated using some type of an inhaler like albuterol to help open the airways and keep the airways from closing up. Whereas chronic bronchitis is associated with like long-term exposure to irritants. So again, it's going to cause the airways to get inflamed and usually causes permanent damage. So it's not going to be fixed. So you can think of chronic bronchitis as like the smoker's cough associated with people who smoke for years and years and years. So the main bronchi are the primary bronchi that move into either the right or left lung. And they also have that hyaline cartilage ring around them. And these are going to lead to secondary and tertiary bronchi, and then to the bronchioles. The bronchioles are the smallest of your bronchis, and these ones have no cartilage, so instead they just have smooth muscle that protects them. And so when you don't need as much air, bronchoconstriction often occurs, where you have less air moving through. If you are taking in more air, bronchodilation occurs where the muscles relax and the bronchi open up, allowing more air to flow into the lungs. And so here you can see a dilated bronchi, and there's a constricted bronchi. Oftentimes, constricted bronchi occur when you have problems like asthma. So asthma occurs when the bronchioles get inflamed and get stimulated to constrict. So asthma is an autoimmune disorder. So, and usually it's associated with some type of allergic reaction. There are different forms of asthma, but asthma in a nutshell is a very serious condition. And typical treatment, so here you see the bronchi of an asthmatic. Here's a normal bronchi. Typical treatment for an asthma attack is using some type of a inhaled steroid and, a bronchodilator. So this is a bronchodilator. This is called albuterol. This is a rescue inhaler. So when you use this is actually going to allow us to get more air in. It opens up those airways. The steroids are typically used to keep the airways from closing. So they are long-term protectors, but you can't use them as rescue protectors. So this is a rescue inhaler. I also use another inhaler every day, twice a day, for long-term protection for my asthma. From the bronchioles, we move into the alveoli. So alveolar ducts lead to alveolar sacs, and alveolar sacs contain alveoli. Alveoli are where gas exchange occurs. And so here is what an alveolar sac looks like, and here is individual alveoli. There's an alveoli, 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 okay? Within each of the alveoli, we have blood vessels directly associated with it, okay? And when air moves into the alveoli, oxygen diffuses across the membrane down its concentration gradient and into the lungs, whereas carbon dioxide moves down its concentration gradient from the blood and into the lungs. So carbon dioxide then can be released and oxygen can move into the body. There are different types of alveolar cells. Type 1 alveolar cells are the most common alveolar cells. And so they're the thin, simple squamous epithelium that allow oxygen and carbon dioxide to diffuse across the membrane. Type 2 alveolar cells are cuboidal cells that protect the alveoli. They produce this chemical called surfactant, and surfactant allows the alveolar sacs to actually close up and then open back up. So there's water, but if you take water and you put it on a piece of paper, it's going to make that paper hard to open. Have you ever had like something spilled on your homework and you're trying to pull the paper apart and it gets hard to move? It's hard to like open that paper. But if it's dry, it's a lot easier to move. So what the surfactant does is it provides a kind of chemical that allows the alveoli walls to open back up. I'm going to stop here because I'm almost done with this video. So, bye.